Hello, Margaret Chan. How are you?
I'm good.
Okay, so nice to find you once again in the 63rd World Health Assembly in Geneva. Last I met you in Bangladesh
Right.
in March this year. So, how was your experience in Bangladesh?
I was very pleased with my visit because that gives me an opportunity to see firsthand what the government is doing in public health. I was very, very pleased with my visit. And Bangladesh as a country, a vast part of the country is really under the threat of the devastations that could arise from flood, from other climate changes. So this is something that the government is paying a lot of attention to, and we are very pleased to see that, and we would be happy to support the government in any way. The community clinic that I have visited impressed me as being local ownership, community ownership. They run their own sort of clinic. They take it as their own property, so to speak. They use their own land with the support of the government to build the clinic. What really struck me is they are very well kept. They involve women in the management, and of course, they provide a model which is suitable for that location. So I still remember what I said during my visit to the clinic. I said, you have found your own model, a model that works for your country. You don't need anybody else to tell you another model. Just keep going with that model and scale up to other parts of the country.
So, you had a call on with our Honorable Prime Minister Sheikh Hasina. How was it?
I was very struck with her commitment to primary health care, to her commitment to MDGs, climate change, and also to improve the health of the people in the country. The country is trying its very best to scale up the achievement of MDGs. I had discussions with, of course, Madam Prime Minister, also with His Excellency, the Minister of Health. I think they have a good way forward to improve the maternal mortality and improve child health, as well as other MDGs like better nutrition. Your country is good in a sense. You understand the role women can play, and Bangladesh as a country, through microcredit scheme, through women empowerment, they are actually contributing to building the country.
As you mentioned, the climate change, its impact on health. How is your experience in terms of Bangladesh?
Well, I mean, climate change is the impact of climate change. We can say that it is already here and now. We are seeing the changes in vectors like mosquito, causing diseases like malaria in places that never reported malaria before. We are seeing a lot of flooding, causing diarrhea, cholera, and so on and so forth. This is something we need to tackle with. And the challenge is for countries to build preparedness and be able to respond as promptly as possible to put people's life into normalcy. And I know that Bangladesh has a plan to look at all the disaster preparedness and response. And the country is serious in looking at mitigation and adaptation measures so that, they are much better able to deal with, what come may with the climate change. I wish the people in the country, under the leadership of Prime Minister and also Minister of Health, will make further progress.